Good afternoon, everybody. This is Mayor Steve Haggerty. I'm sorry that this is starting about 25 minutes late. As everyone knows, this is a rapidly evolving situation for all of us. It's a stressful situation. I mentioned the other night it's going to test our resolve. It's going to test our patience. It's going to test our trust in other people. But personally, I have been there before through many other disasters, from 9/11 to Katrina, where really bad things happen to people, and I've always seen communities pull together and come out stronger. And I really do believe that here for Evanston. And I know that's hard for people, but I would say there very much is a plan. I am in a lot of meetings, and what we want to try to get across to people today in this questions and answers that you've asked is to answer some of those. I know there's misinformation out there. We want to dispel that. We've got our Director of Public Health here, and it's our public health authorities, our medical doctors, and our public health specialists who basically are developing, and it's evolving over time, how we are trying to mitigate this from spreading. And everybody, as you know, has a part in that to flatten the curve and to slow the spread. I cannot stress that enough. This is not a time to have your kids out in the park playing football together and in team sports where they're touching each other in the sport. It's not a time for sleepovers and everything else. This is a time for us to use our very good judgment and follow the guidelines that have been released by the Center for Disease Control. So I'm asking everybody in the strongest terms possible to do that. So let's go and we'll start the questions. They have been provided to us, and we'll try to get through those pretty quickly. And if you have additional questions or things that are coming up as we're speaking, feel free just to post them on Facebook Live, because I know this is Facebook Live as well. So Ike, why don't I start you with the first question. What is being done to assist the senior facility with confirmed COVID-19 cases? And just for background for folks, we have had a senior living facility here in Evanston. As people know, we have a lot of them. We have a wonderful senior community. There have been 2 confirmed cases. The positive news is both of those patients had been hospitalized, and they are coming home today. But there's lots of questions because we all saw what happened downstate with Willowbrook, and that was the first senior living center. So I know there's a lot of questions. I really would like you to explain to our community how things, what the approach is that's being taken, given, again, that we have a limited number of testing capacity and tests. And I will say the testing capacity on these calls with the White House and the governor's office, they are working around the clock to try and increase this. But again, we know we don't have enough supplies and enough resources, hence the reason we all need to work hard and do our part to slow the spread. So Ike, take it away.
Absolutely. So this is a priority for us, and we want to be as transparent as possible about what's going on in Evanston in regards to our coronavirus efforts. This particular community, we had 2 confirmed cases of the coronavirus, and when we got the news, what we did was spring into action. We reached out to our partners, Illinois Department of Public Health, and of course the state's epidemiologist, and one of the doctors who specializes in infectious disease, to craft a response to what happened at one of our facilities here in Evanston. So when we gathered as much information as possible from the experts, we consulted with the administrators, and what we did was what we call contact tracing and also disease pattern strategies to determine people who might have potentially been exposed to these 2 individuals. When that was determined, we sprang into action to coordinate with our local hospital for testing. What we want to do is to identify those who present severe symptoms or symptoms that are indicative of the coronavirus so that they can be tested. And once tested, that would give us a picture of whether they have the virus and whether they do not have the virus, so that we can implement public health strategies and public health responses so that people can be isolated from those who aren't sick, so that those individuals can be monitored. So that's our response, and I want to give a big thanks to the state who has helped us in this regard, and of course our hospitals who help us in this regard when it comes to testing.
I agree. The state has been a terrific partner. The county, Cook County, has been a terrific partner. So question for you: if I am a student at Northwestern, or I am a senior that lives in one of our senior facilities, and someone on my, in my a residence hall or in my wing or in my entire facility of a senior living community develops COVID-19, and they are either self-isolating in that facility or if they really have severe complications are at the hospital. Does everybody get tested then in that residence hall or in that senior facility?
Well, that's not the guidelines from the Illinois Department of Public Health. There are certain criteria for testing, one being if an individual develops symptoms indicative of coronavirus. That's one criteria. Another criteria is if for some reason this individual has some symptoms that are kind of unexplained, for example, an unexplained pneumonia, then the clinician will determine if a test is necessary, and in most cases they do, and I hope they do. And another case would be for people who are returning from areas where there's been high coronavirus activities. Level 3 is actually the highest that the CDC has designated. Those individuals qualify for testing. And another criteria is, of course, those who are living in congregate settings because of the population, them being in a high-risk setting, so to speak. These individuals will also qualify for testing.
So I want everybody that's watching this at home to know that per the public health authorities and the guidelines, they are doing contact tracing. It's a whole survey. There are questions that they ask and everything else, and that is happening here in our city. And it's based on that survey that they decide whether a test will be run or not. And you may say, you know what, a test should be run for everybody. I would agree that would be a beautiful situation. But we're in a situation right now where we do not have the testing capacity to test everybody in that floor. If you had somebody there, you should be taking and adhering to all the guidelines. We all should be, that the CDC has put out about social distancing, okay, good hygiene. That's what's going to keep you safest, is doing those actions. But not everybody in the facility is going to be tested. And I just want to be clear about that. Now, once somebody has, let's say, been in the hospital, let's say they had severe complications, Ike, and they were in the hospital, but now they've recovered and they're ready to go home. Take us through, is it safe for that person to go home and self-isolate, and what precautions or what should they do to protect their family or other people? Maybe they're an older person and they have a care worker that comes in and helps them.
Yeah, absolutely. When they are ready to go home, an isolation place will have to be prepared for these individuals. And of course, the people who are taking care of these individuals will have to wear adequate PPE. What PPE stands for is protective personal equipment that individuals will have to wear so they don't contract the virus. And that will include masks, that will include goggles, gloves, and gowns to receive that individual and also provide that individual with the care that individual needs.
Okay. Thank you, Ike. I just want to remind everybody, too, 80% of the people that will contract COVID-19 will have mild to moderate symptoms, is what we're told by the medical professionals. And it's 20% that will have more severe complications. It's not 20% that need to be hospitalized. I think the statistic that I last saw, and correct me if I'm wrong, Ike, was about 5%. But what we know is the capacity of our hospitals. If all 5% that needed hospital care needed it today, it would overwhelm our system, and our hospitals would have to make incredibly difficult choices about who gets care and who doesn't get care. Again, that's the reason why we need to flatten the curve, stop the spread, and all do our part, again, to make sure that all of us are safe. Everybody plays a role here. All right, we're going to move on to a slightly different topic, but one of equal importance is the fact that our economy, our local businesses, big businesses, you name it, are being decimated by this emergency that we're having right now. And so Jim had written us asking what is being done to help local businesses at this time. I am in regular communication with our state representative, our state senator, our U.S. Congresswoman, and our U.S. senators. And they are working hard to pass federal aid that will get down to our businesses to help them. But again, it's not going to make any of us whole. Okay, this is, again, as I mentioned before, going to affect everybody, but not necessarily everybody equally. The pain will be felt more by some than others, and that's one reason why we all have to come together. But in terms of things that are being done, I can tell you that the City Council took action the other night to waive business registration fees for 2020. They eliminated non-payment penalties for the liquor tax and amusement tax for the next 60 days to try to provide some relief. The City Council also took action and will now allow carry-out liquor along with food items from restaurants here. The federal and state level assistance programs, which there are and they're coming online, are listed on the city's COVID-19 webpage, which you can find at cityofevanston.org/COVID-19. One of those programs is the Small Business Administration Disaster Loan Program. It's an economic injury program. It is a loan program, but I will tell you to those small businesses, I am lobbying to have some sort of cancellation or forgiveness clause placed into those programs. Things are moving really, really quickly. We'll see, and again, this is going to take years for us to recover as a community and a country, I believe. But people are working hard to do that. I will also say our economic development team is working with businesses to see how we can best support you. So I formed a host of different work groups in the community, and so the business work group is being headed up by Roger Sosa, our executive director of the Evanston Chamber of Commerce, along with Paul Zelmazak and many, many other business leaders. And I think they're setting up a whole bunch of sub-units. So if you're a business owner and you're interested in getting involved in that, please reach out to Roger Sosa at the Evanston Chamber. Next question we got was from Kathy about grocery stores and asking if they could start to implement special senior hours. I know several grocery stores have started to do that, Kathy. Jewel has been one, as well as Whole Foods. And it's a great suggestion that you have, and we're starting to see this around the country. So real quick, if you're watching this and you're curious about which stores those are, Target has senior shopping hours on Wednesdays from 7 a.m. to 9 a.m. Whole Foods has it and this is for seniors or those that have compromised immune systems, okay, or an underlying health condition. You can go to Whole Foods daily between 8 and 9 a.m. And then Jewel Osco has their senior hours, or those that have underlying health conditions. They have it from Tuesday. They have it Tuesdays and Thursdays from 7 a.m. to 9 a.m. Now, some of you might be asking, man, why is it so early? Why isn't it later in the day? And the rationale is because it's overnight, where they do a really thorough cleaning of the grocery stores. And so they've set early hours for our most at-risk population to go there. So I think that's a wonderful question, Kathy, and it's nice to see our local grocery stores doing that. Next question was from Diane. Can the city suspend parking meter payments and street sweeping violations during this time to ease the financial burdens? We've gotten a lot of those kind of questions, Diane. We still have to clean our streets because we have to keep our sewers flowing and prevent flooding. So behind the scenes, we're having to put a contingency plan in place, just like many businesses are, for how we operate, and keeping those The sewer system running is critical, and that's why we have to do the street sweeping. The last thing we want, in addition to a pandemic, is all of our basements flooding because we haven't cleaned the streets. So there's a real reason for our infrastructure and something else that's so important. I had somebody else email me the other day and said, well, hey, I'm concerned that our garbage workers are having to pick up the trash and maybe there's some remnants of the disease there. We should stop that. Again, it's a critical, essential service. We need to continue to have trash pick up. But the city is looking closely at all of its services, but street sweeping is regarded as that. Street cleaning violations, you'll be happy with this news. So street cleaning violations will not be issued through April 12th. So we are taking a break on that. No one should be getting a ticket there unless, and I've seen this from the city manager, unless there's some egregious violation. If you're doing something that is totally egregious, you've decided to park and then leave your car right in front of a fire hydrant, you're still going to get a ticket. The city will not be doing any vehicle immobilizations for the next 60 days, okay? And then lastly, all non-payment penalties for parking tickets will be waived for the next 60 days. Again, we're trying to look for ways, and I know the council's working hard to see if there's other ways. So if you have suggestions, please let your alderman know. What is being done to help our homeless? Is this question from Mary Beth. So let's put this into two categories. The first category is we have our homeless prior to COVID-19, and this community had really done a lot to try and support them best we could with overnight shelters. The overnight shelter, and that's offered by Interfaith Action, and then we have Connections for the Homeless, and they're Hilda's Place and everything. Those are congregate centers, so people are pretty close to one another. I'm sorry. It's been a long week, and it's going to be a long time for all of us. So I just need to pause for a second. So what happened is they made the prudent decision that they thought, and I think so too, that it would be safer to end the overnight shelter early. It was supposed to end on March 31st, to end it early so that all of our homeless weren't together. It wasn't because anybody had been, confirmed to have COVID-19. But they took that as a precautionary measure. So a lot of people have written and said, "Hey, we got to do something. We've got to help those folks." And I agree, and I get it. We also, though, need to focus on the folks that develop COVID-19 and they have confirmed cases and they need to isolate. And they need to self-isolate. And the folks that we're most concerned about in that situation are homeless. And so we need to come up with a solution there if they develop COVID-19 and how we're going to help them self-isolate away from others. And then to develop a solution for others that have to self-isolate. Maybe you live, there's 5 of you and you live in a 800 square foot apartment with 1 bathroom. That's problematic. So if we can come up with a housing solution for that one person. So we are working with the county. There's a state task force out of the Illinois Emergency Management Agency. Folks at the EOC are starting to work on this, and that is to find places, hotel rooms, to the extent that the hotels are still open. And again, there's not much business for those hotels. So they're having to let go of a lot of their workers. But find hotel rooms where we could place people, okay, is one solution. Apartments that may be unoccupied is another solution. Residence halls that may be unoccupied is another solution. So we have a team of people, and we're going to be growing that team, run through our National Incident Management System, okay, as a special team that's going to be working on that. I will tell you just from my experience of working with communities for decades now, housing is the biggest and most complex and most challenging issue, and it's not going to be any different. It's not going to be any different here. If anything, it's going to be even more challenging because you'll have patients that you're self-isolating, that we have to help self-isolate, who have a health issue, but it's not requiring them to go to the hospital. They can recover. They can recover at home. I would offer this suggestion because I'm getting lots of emails, and they're all, they're hard, right? They're hard for it's hard for all of us. And I would say that if you've got a parent, and I'm in this situation too, both my parents are alive, which is wonderful, and they're both in their mid-70s, and so they're at a higher risk population. What can you do to help, protect them? And if they do develop it and they happen to live at a senior facility center, developing a plan now for what can we do? Can I bring them to my house if I'm nearby? And can they, be in the basement, or can they be, if I have an extra bedroom somewhere, can they be there? I mean, we're all going to have to problem solve. And I need everybody to step up and try to problem solve and not just say, hey, this is somebody else's problem. It's going to be the government that's going to save me. The government's going to stand up and we're going to try to do our part, but I need everybody, and we need, all of us collectively, everybody, to try and solve problems. Good. A question that's not for me. How do we know how many people, Ike, in Evanston have been infected and tested positive? And that's from David.
Right. So we created a website where we provide information relating to COVID-19. There we provide information in regards to how many people have tested positive. At the end of yesterday, and to be transparent, we have 10 confirmed cases. So if you have any questions, you can always go to our website at www.cityofevanston.org/COVID. You'll find updates there. And this is a way for us to be as transparent as possible to the community and to inform you of the latest. The website is updated every day at 3 p.m. With new information. So the information is provided there, and I suggest that we use it. And not just the confirmed cases, we have other information pertaining to this disease that are posted there that I know that the community will find useful.
Great, thank you, Ike. Here's one that just came in online. Does steam kill the virus? So if I'm at home and I think I have the virus, or maybe I'm self-isolating, should I be taking like a steam shower or steam bath or anything?
Well, with the virus, there's still a lot to be learned about it. The recommendations going forward, and I know this is really related to steam showering or steaming clothing, but the recommendation from CDC and IDPH is to clean and disinfect surfaces. A household detergent or a household substance can actually do the work, and that's what we are encouraging people to do. And like I said, there's just a lot to be learned about this virus, its virulence, how long it remains on surfaces and what have you. But as long as you employ some of these strategies, such as the MPIs, cleaning and disinfecting, you'll be okay. And a common household cleaner should do the magic.
Terrific. Here's another one, and that was from Diana, so thank you. Here's one from Jorge. Can the virus be transmitted through secondhand smoking? And based on that answer, should people smoke outside if they're a smoker?
So the evidence doesn't suggest that the virus is transmitted through smoke. The virus is transmitted through respiratory droplets when you're in close proximity with individuals, and that's why we are always preaching social distance. CDC recommends a 6 feet distance from individuals. That's enough distance so that you do not get those droplets that can be transmitted and cause a disease.
Okay, thank you, Ike, for that one. We've got one from, I think it's Maha, who says, and I'll take this one, why not shut down Northwestern? There are many cases there. So Ike had mentioned we have 10 cases, confirmed cases so far, and that was as of yesterday. And 5 of those cases are Northwestern, either students or faculty or staff, I believe. And so, good question. So I talked to the senior vice president at Northwestern yesterday, and we talked about this subject, and I wanted to give everybody just sort of an update on what's going on at Northwestern. We have 500 or so students that could not go home, so they are still living in the residence halls. The support staff for those students and that's limited because there's only 500 of them, are still there, okay? Again, practicing social distancing and everything else that the CDC is telling us to do. So they're still there. The principal investigators who are overseeing really big research projects, it is up to those principal investigators whether they are having to shut down their research or not. This is really complex research, very scientific, a lot of it that's going on over there, and not easily shut down. I also learned that Northwestern, some of those principal investigators, who are these really smart PhD people that we have at Northwestern, right, are transferring some of their research and moving over to COVID-19 research to do work to help, develop, cures for this, vaccines for this, or whatnot. This is an all hands on deck situation, and we're going to see that across the city and across the country. So that's what's going on with some of those. So you've got some of those staff that are there. And then similar to the city, there's some essential functions at Northwestern. They have their own power plant that those need to continue to run. So those staff are there. But they have a significantly reduced their workforce. I will also say that organizations like the city, and I'm sure Northwestern, have sort of safety officers in place who are also trying to enforce and make sure that people are respecting social distancing. It's one of the reasons we have a split screen right now between Ike and I, because we're both probably more than 6 feet apart, which I appreciate that, Ike. We're probably 7 feet apart. Let's see. Next question. And this is from Esther, so thank you, Esther. And this one's for you, Ike. What is the length of time between exposure and a positive test?
That's a very good question. So there's a term called community spread, and they call it community spread because individuals who've been infected can't particularly pinpoint when they've been infected. So in order for one to fully know when an individual has been infected, you have to know where you got infected, which is very, very hard to calculate. I can tell you what, the incubation period for this virus is 14 days, and that is what we are recommending. So when you start to experience symptoms that are indicative of the coronavirus, and the symptoms, of course, are shortness of breath, coughing, and fever, once you start experiencing these symptoms, the recommendation is for you to call your doctor. And once you call your doctor, your doctor calls you in. He will do an examination, and through that evaluation or examination, he will tell you and provide some advice to you. And in most cases, what's advised is for you to, stay home, isolate yourself until the results come back. So, like I said, keep saying, there's just a lot not known about this virus, but we are taking the necessary precautions possible so that we can limit the spread. But for this virus, it is a 14-day incubation period.
And Ike, the symptoms of this virus are standard, right, across people.
Yes.
And so when you mentioned the cough, what I had read and seen, and again, I would advise anybody that's watching this, if you're like, I wonder what all those symptoms are, go to the Center for Disease Control coronavirus website, and they will have information. They have great information out there, but that it was a dry cough. It wasn't a cough where you're, sort of coughing up. We've all had that kind of flu. The last thing I would say is, during this time, we're all still going to get the normal colds, okay? And you can still get the flu and all the other things that we get. I'm asking everybody to please use your good judgment on when you need medical care. Again, we are trying to flatten the curve. I am very concerned. All people throughout the system, the presidents of our hospitals, are concerned about caring for those that get COVID-19. So when you got that regular cold, pick up some cold medicine at the pharmacy and try to work it out at home. But always call ahead to the medical professionals to tell them and talk to somebody there. Okay. Question just came in from Karen. Are there any COVID-19 patients in Evanston? Yes, there are, Karen. And or are they in isolation elsewhere? So we have a couple different situations. We have people here in Evanston that have COVID-19, and they had some pretty bad complications of it, and they're in the hospital. We have other people that have had it. I would say this is the majority of people, sort of following the data that you're seeing out there, who have been confirmed to have it, and they are self-isolating, okay, in their home, away from their family members. And then, because of the work of Ike and his entire health team, they have identified other people who have been in close enough proximity to confirmed cases where they have been told they need to self-isolate. And everybody's been cooperative. We haven't had anybody that's like, I'm not going to self-isolate. I'm going to go out there and walk around close to other people. We haven't had any of that. I would hope and never expect that we would have that. Anything to add to that, one, Ike?
No, I think you've said it all. You've definitely said it all. So in cases like this, we definitely have not run across any issues where someone has refused isolation. And like you said, I mean, there are two segments to it. I mean, there are some people who will develop complications due to coronavirus. Those individuals can be hospitalized where they are receiving care. Then there's some people, of course, who, after examination, they don't have severe complications to the disease where they can actually go home and isolate. So you're right, Mayor.
Oh, terrific, terrific. I love hearing those words. You're right, Mayor. Let me just say, on that note, we are making choices in this community, all leaders are throughout this entire country, that lie somewhere between bad and less than bad. And we're trying to make less than bad decisions, but that's debatable, okay, and will be debated. But we all just need to pull together through this. Here's a question, Ike. How are we working to get PPEs? PPEs are personal protective equipment. How are we working to get PPEs for all our local medical workers and first responders? And this is from Sarah.
Absolutely. So we continue to work with the Illinois Department of Public Health to secure PPEs for our first responders and those who need it. Just in the beginning of the week, we received a package of a fraction of our supplies, and we're hoping that by next week we will get another package. And the focus now, of course, for the PPEs, our first responders, in order for them to carry out activities in the community, they need PPEs. And of course, there are a number of organizations as well who will be needing PPEs. For example, our long-term care facilities. I understand that they are running low on PPEs. They'll be needing PPEs in order to carry out activities and to take care of the individuals at their facilities. So we're working hand in hand with the state to procure and secure these supplies, because it is very vital in reducing the transmission rate of this virus.
Thank you, Ike. I will add, again, and this is, if you're following this closely in the news, or maybe you're not because you've had enough of this, there is a shortage of supplies, okay, across the board. The face masks, the gloves, all of that. So we are in a situation where hard decisions are being made about how we ration that and who it's provided to. I would say, and I don't know if it's every day that the president and his task force have a conference call. I know Governor Pritzker has his at 2:30 every day. But at the president's conference call yesterday, or news conference yesterday, he said that he was going to enact the Wartime Production Act. And so for people at home to understand what this means basically the president now can commandeer and order and direct, certain manufacturers to start to produce things that we need. So that gets to the second part of what you asked, Sarah, which was about ventilators. Okay, and again, we have ventilators at the hospitals here in Evanston, but again, we are worried if too many people show up at the hospital needing that. We don't have enough. So one of the things is they're going to try and produce more ventilators. But all of this means slowing the spread and flattening the curve, and the work that all of us have to do that. I will tell you, it is going to get worse before it gets better. We've seen that from all the other countries. You look at that data and how it's exponentially increasing. Okay, so these efforts now that we're taking is to help us and protect us, you know what, 2 weeks, 3 weeks, 4 weeks from now to hopefully see that. Start to see some result there and start to see a little bending of that curve. Why aren't you sharing, this is from Peggy, this is a great question. Why aren't you sharing more information about where infected patients have been prior to being tested?
So I'll take that question. So, due to privacy reasons and to protect families and patients, we cannot release that information. But the important thing that you have to know and that we are conveying to the public is social distancing and employing what I call NPIs. These are non-pharmaceutical interventions that you can employ in order to prevent getting this virus, and they range from hand hygiene to not touching your face to coughing into a tissue and discarding the tissue and avoiding crowds. And social distancing is very important. And another important factor is to stay home when you are sick.
Okay. Is it risky to walk outside? Rachel asked. I'll leave that for you.
That's a good question. We are not suggesting that people shouldn't walk outside. What we are recommending is to avoid crowds where social distancing can't be achieved. We want you to be very cognizant of this and very mindful of where you go, and not to congregate in areas where there might be potential exposure because you can't be within 6 feet of an individual. So this is what we are recommending going forward, to practice social distancing, to avoid crowds. For older adults with complications, we also are recommending not to take long trips, cruise ships. So if you employ these strategies, you will be able to not contract this disease, and that's what we are recommending.
Terrific. So I can walk outside, but I should make sure that I'm complying with the CDC guidance of staying 6 feet away from my walking partner if I'm out there walking with my friend. Okay, I know there's a lot of questions, and I have a lot more here. We are in the midst of an emergency, and our public health director and I need to get to the next meeting on this. But I want to thank everybody for tuning in. I want to thank you for your questions. I also want to say that we are at a different time right now where we are operating on sort of emergency time. So we are constantly prioritizing items here in the community. And I know there's lots more questions out there. We'll try and continue to have these types of sessions. I've actually asked our public information officer to get a couple of our doctors from North Shore Hospital or health system that would come on this next time and share with you and answer some of the medical questions that I know people have, and some of them that we weren't able to get to due to time today. Again, if we all band together, we can start to bend the curve and start to get back to the lives we all had 2 weeks ago or 3 weeks ago. It may be a new normal, but we'll get there. And we've seen that start to happen in other countries like China, but it's going to take some time. So thank you, everybody, for tuning in and following the CDC guidance. Thank you.